Hi, I'm Sherri Haas. I am a senior digital health systems advisor through contract in the Office of Health Systems in USAID's Global Health Bureau. Um, Before we get started, I just wanted to do that quick disclaimer that these are my own thoughts and don't necessarily represent the views of USAID. So thank you for being here to share a little bit about myself and my background. I've been in this role since 2021. Prior to that, I've worked as a technical advisor and in project leadership for other global health organizations, covering a range of issues, including digital health, digital financial services, research and evaluation, and other areas of health system strengthening. So thinking about what I wanted to start work on with the leadership project and over the course of the WomenLift program, I wanted to connect it to my role in digital health for health system strengthening and my interest in gender equity in this space. There's a number of important gender considerations that touch on digital health. For one thing, we are specifically dealing with the gender digital divide. Women are less likely to have access to their own technology as well as reliable access to the internet. There's gender considerations across the range of individuals and engagement with this space as well, including women receiving healthcare or access to care for their children, to healthcare providers and health system workers and how they interact with systems and do or don't have access to digital health and the data that it provides, as well as those working in this space specifically of providing digital health services and in the data informatics space. So a couple of years ago, I and others on a gender equity small working group of a cross-organization network previously undertook efforts to examine the equity needs within digital health. That initial review led to recommendations for priority areas for the field to target, including increasing awareness of gender gaps in digital health organizations, programs, and data, growing equitable representation at all levels of leadership, cultivating mentorship and peer support opportunities, and improving the collection of information on gender in research and data and tools to do these things. So as a member of the health system strengthening and digital health teams within USAID, I saw that as an opportunity to build on this work. USAID has strong digital health and gender equity champions and potential future champions across its USAID and global health workforce. And I wanted to move forward to provide access to resources and good practices on gender equity in digital health for our digital health for health system strengthening work. Over the course of the WomenLift program, I've increased my engagement with others in this space through working groups, conferences, and with colleagues within and outside of my organization. I've reached out to digital programs to learn more about what they're working on and how they're thinking about and tracking gender equity, and if they're documenting it or sharing that. There's a number of activities that are ongoing and things that organizations are doing. Some of what I've found is that these processes and tools might currently be used internally to a particular program designed for a particular program or organization or activities. So as I continue to go forward, I'm thinking about ways to draw out those lessons, consolidate some of that information, or maybe convert it, things that might have been created for a specific use case into resources that can be more widely shared and applicable. Over this time, I've also prioritized reaching out to colleagues, and in particular women colleagues from country offices, to connect them with leadership opportunities and learning opportunities that they might be interested in, including supporting, encouraging participation by individuals from a number of country offices to global conferences, making connections to speaking opportunities to showcase their work in digital health, and connect them to other leaders in this space and resources that they can use. That included connecting a couple of women colleagues to the specific opportunity of the Women's Leadership Workshop that was recently hosted by a prior WomenLift cohort member. So as I continue to move forward with this work, I'll gather additional resources and be looking for opportunities to encourage and support generation of relevant tools for gender equity and digital health. I'll also continue to seek out ways to connect and collaborate with colleagues from around the organization and around the world to support learning, sharing, and leadership opportunities. So I've gained a lot through my participation in the WomenLift leadership program. I want to thank the organizers and supporters of the program, as well as my office for supporting my participation. I've in particular valued building relationships with the other women in our cohort and knowing that those connections will stay strong moving forward. Thank you very much.